Hello. Harihi Om. Guru Brahma, Guru Vishnu, Guru Devo Maheshwara, Guru Sakshat Param Brahma Tasmai Shri Gurave Namaha. Namaskaram Samastha. Jnananandamayam Devam Nirmala Spatikakridam Adharam Sarvavidyanam Ajagrivam Upasmahe Ajagriva Etiyo Vadet Tasya Nisrate Vani Yannukanya Pravahavatu Om Shanti Shanti Shanti. My salutations at the lotus feet of Dr. Hahnemann, Master E.K., and other homeologists. My pranams to all the homeo students of this class. Today there is an internet problem in there. Now working through my cell phone. Am I audible and visible?
Yes, sir.
Yes, sir. Yes, sir.
That's it. We will continue the class. Today we will go for a new medicine called Vereita-Carb. Vereita-Carb. Nagaraj sir, are you ready?
Yes, sir.
Yes. Vereita-Carb. Vereita-Carb. Okay. First line. It is derived from mineral kingdom. It is derived from mineral kingdom. Barium carbonate. Barium. It is derived from mineral kingdom. Barium carbonate. Okay. It is suited for dwarfish, DWARFISH, dwarfish children, comma, mentally not matured, and also old people. This is suited to old people also. The main symptoms are dwarfish. Dwarfish means growth is not there. Physical growth is less, mental growth is also less. It is derived from mineral kingdom, barium carbonate. It is suited for dwarfish children. Medicine name Vereita-Carb. Vereita-Carb. Dwarfish children, mentally not grown, not matured, and also for old people. Next. The child will be seen hiding behind the HIDING, hiding behind the mother and furniture child will be seen hiding behind the mother, furniture, or inside the room when strangers come. When strangers come. This is a very peculiar symptom of Parataka. He is having lot of shyness and he doesn't want to expose himself. Particularly when new children will come or new persons come to the house, he will go and hide behind the mother. He will not come in the front and he doesn't want to be introduced to others, even relatives, close people also, unless he is very much acquainted, he will not move with new people. That is the important symptom for Parataka. That is mentally not mature. He does not know how to behave with the new people, strangers. Okay. Next line. Lack of confidence. This you can see the people, the children who are backward in the studies. Lack of confidence. Next line. Students not up to the mark in studies. Not up to the mark in the studies. Particularly poor in mathematics. Particularly poor in mathematics. It's a very unfortunate thing is the teachers as well as the parents punish the child, thinking that he is doing intentionally. He doesn't have that much grasping power. He doesn't have that much intelligence. He can't comprehend 2, 3 things at a time. Mathematics requires comprehension. 3, 4 items you have to see in one time, simultaneously. That is possible only with medicine. But we punish him. That is very important. Remember, no child is to be punished. When he is not up to the mark, backward, means we have to get him homeopathy medicine. Any child, either your child or relatives, child or friends or anybody. Some teachers are there in this class also. Even those teachers must note down that the child is not up to the mark. Some medicine is required by it, not the punishment. Particularly homeopathy, you will have wonderful medicines like this. I have treated many people. One case, I tell you, a boy aged 14 years. Both father and mother are very well educated, but he is not able to get good marks. 8th class up to 9th class, government will pass, automatic pass is there. 9th class, they found in the school exam that he is having mathematics some 9 marks, other classes also, other subjects also very less marks. Then the mother brought this child. When the mother has brought the child, it is understood that he is having very poor memory and very much backward in the classes. They have not taken care up to the 9th standard, 14 years. With entering the 10th class, then they have come to know about homeopathy and they came to me. The mother said whether my boy will get through 10th or not. She asked me. And I said, no problem, we will try. Then the medicine was given, Beretta, and now he is doing the engineering, B.Tech. This is the case of
Sir, voice not audible, sir.
voice not audible.
No, sir, it's fine. Basically,
Okay.
common issue.
Okay, it is okay for others, then no problem.
Yeah,
Okay, okay.
I'm aware
So,
of that.
Sir, few seconds it is stopped. That's all.
no problem, no problem.
No, it's okay.
Ganesh, no problem. Right. That boy now is doing engineering in Mata Amritanandamaya Institute. A person who was supposed to mother requested only one thing. Sir, please see that my boy complete 10th class so that we can put in some small jobs. It is not like that. Homeopathy makes him. Now he got, in the class, he got more than 80% something. And intermediate +2, he got very good marks. He got admission into engineering also. This is only because of Garetaka. Okay. Next. Bashful, Bashful. 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 Bashful is the another meaning of shyness. Very much shyness. A higher degree shyness is called bashful. Very much shy. Okay. Next. Same line. These are the important symptoms, hence repeated. Bashful. Shyness. Yes. Next point. Aversion to strangers. Aversion to strangers. Even with the children, he will not play. He will play only with the children who are less in standard, who are less in IQ. And relatives and other things he will not talk to them. Aversion to strangers. Next. Weak memory. WEAK. WEAK. Weak memory. Memory is very poor. He can't reproduce what was told in the classes. Weak memory. Cannot remember and learn. Cannot remember and learn. So memory is a problem for him. So he will not get marks in the class. Because he doesn't get marks, he is further demotivated. And everybody scolds him, teachers, parents. So further demotivated. That will spoil his small confidence levels also will come down. When he came to me, I boosted his confidence levels. I told you, you are very intelligent. You can do lot of things. You can do many things. People will talk, don't worry whether you get marks or not. Study the subject. Like that, I motivated him in 10th class. Now he is in BTech second year. Next point. Lack of comprehensiveness. Comprehension power is not there. Lack of comprehensiveness. He can't do 3-4 things at a time. He doesn't have that much capacity to think about 3-4 things at a time. Multitasking is not possible. Even simple mathematics like 100 rupees, you take them to the market. Suppose 20 rupees you have spent. How much will come back? It will take 2 to 3 minutes to calculate. Small calculation also. This is only because of the symptom of the mind, not intentionally. You should always feel anybody is doing wrong. It should not be intentional. Intentionally doing wrong is opium. Another drug is there. We can give medicines to them. But this boy is because of the lack of comprehensiveness. Food, memory. Okay. Next. Children are slow. Children are slow. Next. Late in their studies. Late. They will try not to study. not to learn, because it's a very big task for them. They avoid reading books. They avoid going to school. They are late in their studies. They can't do anything immediately. It will take time. Okay. Next. They are late in coming to usefulness. They are late in coming to usefulness. Everybody calls them as useless fellows. They are late, but they are intelligent. Something you remember, they are definitely intelligent. Sometimes they show intelligence in other things, but studies they are late. They will tell only one thing. They will always ask one point. When can I finish my studies? I don't want to study further. 10th class finish means it's just enough. I can do some petty job, something. I will learn. They can't do degree, they can't do post graduation, PhD, this and that. They said no. Nothing is possible. Next. Late learning to talk. Late learning to talk and walk. Walking also late learning. It is not because their strength is not there. No doubt. Physical strength is very much available. Physical strength is there. Physical strength is there, but mental dwarfishness, fear in the mind. Hence, they don't come to usefulness immediately. And they can't do 2-3 works at a time. Suppose you ask it, you take this glass, keep it in the kitchen, then you take that, bring the plate and come. Then he will tell, don't tell me 2 works at a time. First you ask me to keep the glass, I'll keep. Then he will ask what next. Then you have to say, bring the plate. But if you tell 2-3 things at a time, he will say, no, I can't do it. Because mind is not that mature. Mature, but fear is there. Okay. Next. Cannot make combinations. Very poor in combinations. Permutations, combinations, clubbing one with other. No. Cannot do combinations. Cannot make. This is one of the very important symptom of Barrett-Rakar. He can't make combinations. Very poor, I told you, in mathematics. And very poor in formulas. Can't remember the formulas. Physics and chemistry also very much difficult for him. If he wills, he can write something. Only if he wills. If he likes to do, he will do. Otherwise, no. Whatever punishment you give, he is ready to receive any amount of beatings from the parents. He says, I cannot do. Why do you beat me? Like that you will tell. With homeopathy, with Barrett-Rakar, we can make those children normal. I have given to thousands of students of that age, children. Please don't punish them. Get them homeopathy. Next point. Childish behavior, even at the age of 20 or 25. Childish behavior. Even at the age of 20 or 25. So, they behave like a child, irrespective of the age. Okay. Playing with the dolls and small children. He always prefers to play with the children not lower to his age. Playing with the dolls and small children younger to him. You will be immediately, you can recognize him. All 6 years, 7 years children, but he is 14 years old. By seeing that, you can identify his Barataka. Very easily we can cure such cases. Next, timid, Timid, is not daring, timid. Timid, not daring. Then timid, not daring. Then easily frightened, Fraghtned, easily frightened. Opposite is opium. Opium will never get better, but he gets very seriously gets. But with the Beretta carb, you can easily frighten. Next, lack of ability to think, even at thought level, to give him some imagination, something. He can't do. He says, I can't imagine also. So same, I will give you 100 rupees, out of which you give me back 10 rupees. Then you give 10 rupees to your sister, or 100 rupees out of 100, you pay 20 rupees to the shop. No, don't tell me all those things. First, you don't give me 100 rupees. Then we will see. Because he can't do calculations so easily. He can't think also. Ability is not there. Next. Always borrowing troubles. Always borrowing troubles. What is borrowing troubles? Always he will be doing some mistake or other. Because of the lack of ability, he is always in troubles. He will do something like this, like that, that should not be done. Then he will do some mistake and somebody scolds him. So always borrowing troubles. Next. Full of imaginations. He will imagine on his own. He is in his own world. Full of imagination. If you give imagination, he can't do. But he will be doing something on his own. Full of imagination. Next, very important point, VIP. The patient does not respond immediately. Patient, are they good at art? Some are good at art, yes. The patient does not respond immediately and seeks some time. Seeks some time. This is a peculiar, very important point of Barataka. Suppose the mother or father, they call him, come on, food is ready. He immediately will say, wait. Wait is a keynote for Barataka. They will not come immediately. Anyway, they have to come. And call is there for food, everybody is ready to eat. This fellow will be playing something or sitting somewhere. Mother calls, he says, wait. Any child telling wait, wait, wait is Barataka. You can easily identify. And he always seeks some time. Wait, I'm coming. You are in a hurry. I'll come. Either you will take half an hour. Even for food also, keep put everything ready. You will not take immediately. Wait. Writing, suppose you want to make him study, bring that book. Wait. That is a key word for Barataka. Very important. Next. Enlarged stomach. enlarged stomach. That is abdomen bloated. In calcarea carb, head is large. Beretta carb, stomach is large. But body emaciated. But beauty, but body emaciated. Body will be very lean. But you can say, observe the belly, more belly. Body emaciated. Next. The baldness in young children. The baldness in young children. No, not like sulfur. It is not like sulfur. Baldness in young children. In fact, this is the leading point for me for the case I referred. A boy of 14 years old having lot of baldness. That has given me link, and also mother says he will not call, he will not respond to the call. So wait. Those 2 points led me to Paradaka. And that has cured him completely and permanently. He got more than 800 marks in a +2 per 1000. Baldness in children. Then scalp, SCLP, scalp is head, above head. Scalp sensitive to touch. Scalp is very sensitive to touch. So combing he will do on his own. Lady girl is there. Mother, if she starts combing her, she will say pain. Slow. Slowly you have to comb. Because scalp is very sensitive to touch. This is one of the leading points in Beredaka. They will take lot of time. Finish a bathroom or eating or taking bath slow. Next. Weak digestion. Digestion is very poor. Can't digest the things easily. Weak digestion. Another very important part, VIP. Enlarged glands, particularly tonsils. Enlarged glands, particularly tonsils. These children will be suffering from tonsillitis. That is, they get operated for tonsils. Operation, itis means inflammation. Tonsillectomy is called operation. Always glands are enlarged, particularly tonsils. This also is one of the indications of Beredaka. And one more important point here I wanted to tell the students of this class. Never get the child operated for tonsils. Tonsils are the important organs of the person to protect the person from any kind of infection. Tonsils are like in our Puranas, we have got Jaya and Vijaya, who are the bodyguards or security guards for Vaikuntham. Jaya and Vijaya. You can see in Tirupati also, Jaya Vijaya. 2 statues will be standing outside the sanctum sanctorum. Jaya and Vijaya are the security guards. They don't allow anybody to go inside. They are very important persons. Tonsils are like Jaya and Vijaya. 2 sides, tonsils will be there. Any infection tries to enter the person, they swell, they take the infection, and they are swollen, and pain will be there, and tonsils will be a bigger size, and infection, they take infection on their own, so that the person is safe. Unfortunately, the doctor says they are to be removed. If you remove the tonsils, means you are removing the security guards, making the way for the thieves to enter very easily or enemies to enter. It is always safe that tonsils are there. For the enlarged tonsils or cough and cold and other things, you see the symptoms, and Beretta is very frequently select. That is the reason you should not undertake the operation of tonsils for any child. That is the important instruction. Next point. Knots, KNOTS, knots of lymphatic glands. Knots of lymphatic glands down the neck, under the ear. So there are lymphatic glands here under the ear. They are also swollen and there are some knots are there. A little extra growth there. Beretta will completely cure. No surgery. Okay. This is important. Next. Rattling sound of respiration in the nights. Night respiration is difficult. There will be rattling sound. Like that, it is difficult for him to take the inhalation. Okay. Next. Dryness of mouth early in the morning. Dryness of mouth at the morning. Next. Saliva. Saliva runs out of mouth in sleep, making the pillow wet. Saliva, night time mouth, water will come out. Calcare carb also, pillow will be wet by head sweats. Beretta carb, pillow will be wet by water, that is salivation from the mouth. And they keep the mouth open and looks like idiotic child. Very less growth. You can see Beretta on seeing itself, you can identify the Beretta carb patient. Okay. Toothache in decayed teeth. Toothache, T-O-O-T-H. Toothache in decayed teeth. Before menses or from cold. This is the symptom. Toothache in decayed teeth. Continue. Before the menses or in cold. And the pain seizures, C-A-S-C-S.
So kindly repeat, sir.
Decayed teeth,
Before menses.
decayed teeth, toothache was decayed teeth before menses
Hmm.
or from cold, COLD.
Okay.
In cold season, they get toothache. And seizures, seizures, seizures. When mind is diverted, they will be telling toothache, toothache. Suppose mind is diverted in some other job, toothache disappears. That means toothache is not with the tooth, but with the mind only. So this is another very important. Next. Causation. CAUSCATAY. Causation of where bariatric are required. What are the causes? Number one, causation. Number one, tonsils. Tonsillitis. Itis inflammation. Tonsillitis. Comma. Suppression of foot sweat. Suppression. SUPP. Suppression. RESSION of foot sweat. So suppose the patient has taken medicine. Generally, foot sweats are there with bariatric. For that, some medicine is taken and it is suppressed. Then you will become bariatric. Okay. Cold drinks and cold air. Bariatric symptoms are aggravated from cold drinks, cool drinks, and cool air. Okay. Then every cold settles in throat. Every cold settles in a throat and feeling of a sensation of plug in the throat. There is something, plug is there, something obstructing, like that he will tell. Feeling of a sensation of plug in the throat. And whenever he gets a problem, throat is the center. Okay, that is point. Next. Next point. Enlargement of prostate gland. As the throat runs, the heart, it won't act. There is pain. He feels. It is all feelings. Enlargement of prostate glands in old people. Childish behavior in old people. They behave like children. Childish behavior in old people. Next. Sleep talking. They will be talking in sleep, children. That is also a mindset. Sleep. Next. Idiotic and foolish behavior. Idiotic and foolish behavior with low IQ levels. Intelligent quotient will be less with low IQ levels. Next. Child cannot be taught. TAUGHT. Child cannot be taught. Because of the poor memory. because Guru. He does not want to play, but sits in a corner. Sits in a corner. Then fear of a future. He has a fear. In future, what will happen? We don't know. Fear of future. Easily takes cold. He will become cold, particularly in climate like Bangalore. He will be getting lot of cold, always cold. It is a constitutional remedy. It is a constitutional remedy. Come on, very deep acting. And suited to both extremes of life. Suited to both extremes of life. That is children and old people. Both extremes of life. That is children and old people. Then sterility in women. Sterility in women. That means they don't get conception. If the variety of symptoms are there, the woman is very dwarfish, lack of confidence, and small. It is a wonderful remedy that they get conception. Sterility of woman with a small button uterus. With a small button uterus.
Sir, kindly request you to a small.
Sterility in woman
Hmm.
with small or button uterus. Uterus is small size. So they don't go for even menstruation also. Sometimes menses is delayed. 18 years or 19 years, they don't get. Is one of the symptoms. Button uterus means uterus is not of the normal size. It's a wonderful remedy. Okay. Next. Aggravation in the evening. Aggravation in the evening. Midnight. Evening, midnight. Lying on left side. Lying on left side. Active movement. His complaints aggravate when he's actively moves. So he doesn't want active movement. Active movement, comma, ascending, ASCENDING. Ascending is climbing the stairs, going up. Ascending, comma, cold air, from thinking of the problems. Next, VIP point, very important point. Weakness after eating. Weakness after eating. This is a wonderful point, Beredaka. Generally, the people take food to get rid of the weakness, to get the strength. But with the Veretakar, if it takes food, he will be weak. So, he will become weak after eating food. It's a peculiar symptom of Veretakar. You tell me any work before eating, because after eating, he becomes very weak. And it will take time to regain the strength after eating of some time. This is one very important point of Veretakar. Okay. Wants to be wrapped. WRAPPED. Wants to be wrapped. Wrapped is putting lot of clothes. Wants to be wrapped. But pains are better from open air. But pains are better from open air. Next. Next point. Chronic cough. Chronic cough. This is one of the very important points of Veretakar. You will be having the throat pain, cough, cold. These are things, common symptoms. And I told you very important signal is weight. Whenever he says weight, then give Veretakar, idiotic behavior, and dwarfish growth is not up to this one because it has stunted growth. And children with the playing with the smaller children, younger children to them, he wants to command. He will always, he will be the leader of the group. But at the same time, he doesn't want to play with them. He will always show negative ideas. I don't want to play, I will take rest. Like that. But this is Veretakar. We finish with Veretakar. Any questions are there? You can ask. This is a very who is not up to the mark. There is no growth. It is a trouble remedy. You make them not. They are not weak by birth. They have the comprehension. You have to give them according to the symptoms. Okay. Now, Satyanarayana.
Sir. Madam Salima Lalani.
Namaskar, sir. My question is, there are people with alopecia, they have issue in the scalp, pain in the scalp. So the pain comes because of the alopecia, but with Barretta, is it from the beginning?
If mind is not Veretakar, don't give Veretakar.
Okay. And with the dwarfishness, will the
Very-
height will start increasing,
In symptoms, if they don't tally, if they are intelligent, Veretakar.
Okay. Thank you.
Next.
Bhavana M.
Very good evening, sir. Sir, as we see, the Bharata person is a dull person. basically idiotic person, right? This is the basic characteristic of that. Then the other symptoms comes into mind. Now you have said that the main symptom of this is the person will say wait for everything. If you give food, he'll say wait. If you say study, he'll say wait. If you say you have to go, he'll say wait for some time. But if the child is super intelligent, he's intellectually very bright, can the point of wait be taken into consideration?
Cannot give. We cannot give beta carb to a person who is very intelligent.
Sorry, your voice is cracking actually.
If the person is intelligent, beta carb
Yeah.
will not, just because
Okay.
other drugs are there.
Uh-huh.
Mind with fish, not grown to the extent.
Right.
Mind is important in beta carb. Any homeopathy
Right.
drug. Next.
Right. So in that case, in this kind of a person, Baretta carb can't be given.
No.
So what could be the remedy? What could be the remedy for this kind of a person? Different alternatives or something like that?
Madam, we have to see the totality of the symptoms.
Uh-huh.
First one symptom, I can never prescribe the medicine. That other
Mhm.
person or the other symptoms. We have to see the totality and prescribe. Okay.
Right. One more thing, sir. I was studying a case study of Baretta carb where the person, because he was dull and the saliva was coming out, was rolling out from the mouth. At the same time, her uterus was not being developed, but later on it was properly developed, and even the allopathic doctors were astonished seeing that. And at that time, Baretta carb was given by the doctor. Is that right?
It will work. It is right.
Right. Thank you, sir. Thank you very much.
Pradeep Kumar Gummalla.
Good evening, sir.
Yes.
Sir, what is the potency to be given for the child, sir, in this bariatric carb if totality matches?
You joined late. Listen to the previous class.
Okay,
Next.
sir.
Sanjay
Thanks.
Gaud. Sanjay Gaud.
Good evening, sir. I'm from Hyderabad.
Yes.
Sir, whatever your conditions will be telling, so this everything problem in my son. So can you suggest how to will take the medicine given to the child?
To bring him
Or
to the
otherwise,
clinic, I will see the symptoms properly. And just because you attended the notes, you cannot.
yes, sir. And no, I'm not tech side, but where I'll go and take for this kind of suggestion.
And another
Sorry,
day,
sir.
Sir, you can come to, sorry, interrupt to Guru Garu. So you can come to Bangalore to visit Guru, or sir, we can give Murli sir's number in that case.
Sir, we are Hyderabad, sir.
That's what.
can come.
Okay. Oh, sorry.
Thank
But while answering some question, somebody has told whether sulfur can be given. Asked. That can be. They gave sulfur, and skin problems aggravated.
Okay.
Now skin problems aggravated. They are feeling very bad. Just because you can give one dose, they have given one dose, not seeing the other symptoms also. It is always the totality of symptoms. And skin problems aggravated after sulfur, it is a good sign. Not to worry. Everything is coming out. So not to take medicine just on listening to one class and not to give medicine to family members. Part of study. Even with the experience of 52 years of clinical experience, I still feel case is to be studied completely. Please do not prescribe on listening to 1 hour class. Okay.
Thank you, sir.
Andekar Nagaratnam.
సార్ నేను తెలుగులో మాట్లాడతాను. సార్ నేను ఒక 15 ఇయర్స్‌గా హోమియోపతి మెడిసిన్‌కి అలవాటు పడ్డాను. అంటే వాడుతూ ఉన్నాను. ఓకే. నాకొచ్చిన డౌట్ ఏంటంటే మీరు చెప్పిన దాంట్లో సింగిల్ డోస్ మాత్రమే ఇయ్యడం అనేది కరెక్ట్ అయినది అని విన్నాను. అయితే వాళ్ళు ఉదయము, సాయంత్రం అట్లా వేరువేరుగా ఇస్తుంటారు. మళ్ళీ వారానికి 1, వారానికి 2 సార్లు. మళ్ళీ సమ్ టైమ్స్ సీరియస్గా ఉందని చెప్పేసి 1 అవర్కి ఒకసారి డోసు ప్రిస్క్రైబ్ చేస్తూ ఉంటారు. అయితే ఇలా నేను చాలా డిజార్డర్స్ తోటి వెళ్ళిన అక్కడికి చాలా కూడా క్యూర్ అయ్యాయి సార్. మరి ఓకే కదా ఇది?
నేను అలా చెప్పలేను సార్, ఎందుకంటే హోమియోపతి అనేది ఇట్స్ ఎ ట్రిక్కీ సైన్స్.
ఓకే.
You have to study the case properly. Because only one person is practice like that, I cannot criticize him.
Okay.
Strictly speaking, as per the Hahnemannian principle, we give medicines such a very frequently and higher potencies or daily 3 doses. It cannot be called as homeopathy. It is something else.
Okay.
It is left to their discretion. I don't it is bad or good or correct or not. But according to Hahnemann, it is wrong.
ఓకే. అకార్డింగ్ టు యానిమల్ సింగిల్ డోస్ ఇచ్చే వాళ్ళు మాత్రమే కరెక్ట్.
Call it as
ఇంకోటి సార్, ఇంకోటి మీ క్లాస్ జరుగుతూ ఉన్నప్పుడు మెసేజ్ రూపంలో ఇస్తున్న నోట్స్ మాకు చాలా ఉపయోగం పడుతున్నది రాసుకోవడానికి. ఆ స్పెల్లింగ్స్, ఇంకా మీరు చెప్పేటప్పుడు కొన్ని ప్రొనౌన్సియేషన్ మేము మిస్ అవుతున్నా ఆ నోట్స్ వలన మాకు ఉపయోగపడుతుంది సార్. థ్యాంక్ యూ సార్. నా నాగరత్నం, హైదరాబాద్.
Sir, can I speak for 2 minutes here, sir? Guru garu.
Okay.
Nagaratnam garu, నేను బ్రాంకైటిస్ పేషెంట్ సార్ నేను. ఓకే.
ఓకే.
నేను ఇంగ్లీష్ మెడిసిన్ వాడాను, ఆయుర్వేదిక్ వాడాను. 1 year వరకు తగ్గలేదు. ఆఫ్టర్ 1 year అంటే ఐఎమ్ టాకింగ్ అబౌట్ 2000. దెన్ ఐ టుక్ హోమియోపతి. నాకు అప్పుడు ఆ గురువు డాక్టర్ గారు యాల్సల్ ప్రెస్ చేశారు. యాల్సల్ 30 ఇచ్చేవారు నాకు. బాగా సివియర్ అయితే యాల్సల్ 200 ఇచ్చేవారు, 1 ఎప్పుడైనా ఇచ్చేవారు. కాకపోతే అది నేను అంటే వీక్లీ ఎవ్రీ డే 1 time వేసుకునేవాడిని నేను. ఓకే. నాకు 25 years వరకు బాగా తగ్గింది, కానీ మళ్ళీ చలికాలంలో వచ్చేది. హాట్ వాటర్ కంపల్సరీ సమ్మర్లో కూడా నేను ఆంధ్ర వెళ్తే హాట్ వాటర్, కోల్డ్ వాటర్ స్నానం చేస్తే ఎగ్రివేట్ అయ్యేది నాకు.
ఓకే.
గురువు దగ్గరికి వెళ్ళిన తర్వాత నాకు 2 weeks వీక్లీ 1 dose 2 doses ఇచ్చారు సార్. 2021లో 22లో స్టార్టింగ్ లో. నేను 2023లో వింటర్లో చలి స్నానం చేశాను సార్ బెంగళూరులో. దట్ ఇస్ వాట్ మై కేర్. సో సింగిల్ డోస్ వర్క్ అవుద్ది. 2 days వరకు అప్పుడు అయితే మాకు టీ కాఫీ ఆగమని చెప్పలేదు. మసాలా అన్ని తినేసేవాళ్ళం మేము జనరల్ గా, కంటిన్యూ మెడిసిన్ వేసేవాళ్ళం. గురువుగారు నాకు స్ట్రిక్ట్ గా ఫుడ్ మానిపించేశారు, టీ కాఫీ మానిపించేశారు. ఇట్ సాల్వ్ విత్ ఇన్ 3 weeks సార్ ఫర్ మీ. అండ్ 30 years బ్యాక్ ఐ హావ్ ఫేస్ అ ప్రాబ్లమ్ ఆఫ్ హైట్ ఫోబియా.
ఓకే.
అది గురుగారు నాకు వన్ డేలో తగ్గిపోయింది సార్ ఆ ప్రాబ్లం. నాకు స్కైగ్రాఫ్ ఎక్కి నడిచాను నేను.
ఓకే.
రియల్ ఎగ్జాంపుల్ మీ ముందు అన్నాను సార్ నేను.
ఓకే, థ్యాంక్ యూ సార్.
మురళీకృష్ణ
ఇంకో ఒక్క చిన్న సార్, ఇప్పుడు కాఫీ, టీ అనేది హోమియోపతి మెడిసిన్ కి యాంటీగా ఉంటాయి కదా, అలా క్యాంపర్ కూడా ఉంటుందని విన్నాను. ఇంకా అలాంటివి ఇంకా ఏమున్నాయో అవి కూడా తెలుపగలరు సార్? ఓకే, థ్యాంక్ యూ సార్.
మురళీకృష్ణ.
Namaste, sir. Yes, can we suggest this biodata cup to the child whose mercury is badly spoiled in his chart?
Chart mercury. Yes, correct. Mercury is not in a exalted, is spoiled, then he will be not. Yes.
Guru, your voice is breaking actually.
మెర్క్యూరీ కనుక సరిగ్గా లేకపోతే వెరైటీ గారు పనికొస్తుంది.
ఓకే.
మెర్క్యూరీ వీక్ గా ఉంటాయి.
ఓకే.
నెక్స్ట్
కృష్ణావి.
నమస్కారం మాస్టర్.
ఎస్.
స్కూల్లో స్టూడెంట్స్ ని అబ్జర్వ్ చేస్తుంటే ఎస్పెషల్ స్టడీ స్కిల్స్, మ్యాథమెటిక్స్ ఇవి 100% సింటమ్స్ టాలీ అవుతున్నాయి. రిమైనింగ్ సింటమ్స్ 40% బెరైటోకార్బ్తో టాలీ అవుతున్నాయి. Can we suggest Baraitacarb?
Can suggest Baraitacarb to such cases.
Thank you, sir.
2 doses we can give, but
okay.
Do not give the medicine without the consent from the parents.
Okay.
The parent, you have to give to them. Let them approach a homeopathy doctor. Let them take properly. You don't prescribe. Okay. You only educate them.
Yes, yeah.
Next.
Roshan Bhatta.
Namaste, sir. So I wanted to know if there are any complication or anything we have to care for giving medicine for Sattvic vegetarian person or one with the one who eat meat and eggs and everything. So, is there some kind of differences?
See, homeopathy will not work for those who do not follow the diet restrictions. It is as if it's. So those who follow restrictions, homeopathy gives its action.
Oh, okay.
Next.
Yarasuri Prasad. VMD. VMD.
సార్ నమస్తే సార్ అంటే హైదరాబాద్ నుంచి సార్ ఇప్పుడు ఓల్డ్ ఏజ్ పీపుల్లో ప్రోస్టేట్ గ్లాండ్ ఎన్లార్జ్మెంట్ కి బెరిటా కార్బ్ రికమెండ్ చేశారు. మిగతా సిమ్టమ్స్ టాలీ అవ్వకపోయినా అది ఇవ్వచ్చా అండి?
ఇవ్వకూడదు.
ఓకేనండి.
టాలీ అయితేనే ఇవ్వాలి. టోటాలిటీ ఆఫ్ సిమ్టమ్స్.
ఓకే ఓకేనండి. ఓకేనండి. థ్యాంక్ యూ సార్. నమస్తే సార్. మై నేమ్ ఇస్ వేణుమాధవ్ ఫ్రమ్ గుంటూరు. Sir, you said tonsils should not be removed with operation in the children. So what if it is all removed with the same tonsils issue?
Better like next birth.
Okay, sir. I have another doubt. You said the childish behavior in the old people. So could you please give some examples, like childish behavior in old people?
Example is very clear. They will always try to play like a child.
Okay.
They will be playing with dolls, with small children.
Okay.
In parks, moving that swing and other things. Uyedi.
Okay. Okay.
మాటల్లో కూడా అంత మెచ్యూరిటీ ఉండదు.
ఓకే, థ్యాంక్ యూ సార్.
నెక్స్ట్
పద్మప్రియ.
నమస్కారం మాస్టర్ గారండి. మాస్టర్ గారండి, ఇప్పుడు బేరటా కార్బ్ పేషెంట్స్ మరియు ఆటిజం తో సఫర్ అవుతున్న కిడ్స్ ఇద్దరి సింప్టమ్స్ ఆల్మోస్ట్ ఈక్వల్ అండి?
ఆటిజం అనేది ఒక సిమ్టమ్ అంతే. బెరెటా కార్బ్
ఇట్స్ ఓన్లీ వన్ సిమ్టమ్ ఆఫ్ బేరటా కార్బ్.
Autism is one symptom, yes. Autism, other symptoms, if they tally with Beretta curve, Beretta is the medicine.
ఓకే ఓకే, చాలా థ్యాంక్స్ మాస్టర్. ఉంటాను.
వేణుగోపాల్ బి.
నమస్తే గురుగారు. ఇది సెల్ మెడిసిన్స్ గురించి కొంచెం తెలుసుకోవాలండి. అది ఎఫెక్టివ్ గా ఎట్లా ఉంటది ఈ మెడిసిన్స్ కు అన్నది కొంచెం చెప్పగలరా? సెల్ మెడిసిన్స్, బయోకెమ్ మెడిసిన్స్ ఉన్నాయి కదా.
టిష్యూ రెమెడీస్ సార్.
టిష్యూ మెడిసిన్.
Class, wait, attend other classes.
ఓకే ఓకే.
Full session.
ఫుల్ సెషన్ ఉంటుందా? ఓకే.
థ్యాంక్ యూ గురుగారు. That's all.
Okay, we'll close the session here.
Sir, only one thing I wanted to add, sir. Yes. Sir, what you were telling, that one person was asking about should we give single dose?
Yes.
Never in homeopathy we should take single dose as minimum dose. Minimum dose, what is minimum is required is maybe single dose or multiple dose depending upon the case.
Yes, depending upon the case.
That's what I think Dorothy Shepard has written a book, Magic of Minimum Dose. She very clearly tells, and also you have told us when you taught earlier class.
Correct.
What is minimum for that is that minimum, not single dose.
Yes.
That minimum you have to give. Thank you.
It may work, sir. That's what for me it's working. After a long time of multiple dose, it works for a single dose. Probably immune development for me. It of 25 years, we don't know, but it cures me now very 100% for me. I am free body with cold.
Thank you very much.
Thank you so
Thank
much.
you, Guruji.